Hi, I'm Les Wilkinson with the law firm of Wilkinson Magruder, and I'm here with Andy Magruder, my law partner, to discuss some issues involving Social Security disability. Andy, sometimes you see people come in and you look at their records and there's a lot of alcohol involved or drug addiction. How does that affect their ability to get Social Security disability?
That's a great question, Les. And if someone has a diagnosis of alcoholism or illegal drug use or even improperly using prescription drugs, then Social Security is required under its rules to evaluate if the alcoholism and or drug use is material to their disability. And let me give you an example. Oftentimes when people come in and they've got serious mental disorders, bipolar disorder or schizophrenia or depression, oftentimes alcohol and drug use just sort of naturally follows those illnesses, okay? And so you may see someone who has bipolar disorder, but the records also show that they, have a history of using illegal drugs, which oftentimes can be a symptom or cause of their mental disorder. And what Social Security has to do is, if the person is still using alcohol or illegal drugs, they've got to make a decision. Basically, is this person disabled? Okay, are there limitations severe enough that they prevent them from doing work? And then take out the alcohol or drug use to see if they stopped using alcohol or illegal drugs, would they still be disabled? And that can be a hard distinction to make. And oftentimes, the opinion of a treating psychologist or psychiatrist is very important if there is continuing alcohol or drug use to make that decision that yes, even if this person stopped using illegal drugs or alcohol, they would still be disabled. Now, this issue also comes up if, a lot of times if someone has a physical impairment, okay? And let's say someone has a herniated disc and it impacts their ability to walk and stand and lift. And as you're reading through the record, you see, okay, well, there's an occasional positive marijuana test in the medical records. In this case, and it's going to be hard for the judge to say that the marijuana use might be material to the disability because the person's going to have the back pain regardless of whether they occasionally use marijuana. But in that case, the drug use is really going to be a question of their credibility, okay? And what I always tell my clients in a case like that is you have to be, well, in all cases you have to be 100% honest with the judge, but particularly in this case, because judges are great at evaluating people and whether they're telling the truth or not. And if a judge sees that there's marijuana use in the file, the judge is going to ask the claimant about it. And if the judge doesn't, I am, because it's got to be an issue that's addressed. And if the judge doesn't believe that an individual is being 100% truthful about the drug or alcohol use, then he may not believe their testimony when it comes to the most important issue in the case, which may be their back pain.
And I've had cases, Andy, where speaking of back pain, somebody's got a lot of back pain, they've got a lot of problems or whatnot. But like I say, how do you describe pain? Pain is really subjective, and so if the judge believes you and he believes your credibility, that's what you need him to do. What happens is he looks through the record and he says, well, you told this doctor on this date you hadn't used any drugs or marijuana in 3 years. And I get this report here last week, by the way, and it shows a positive urine screen for marijuana and cocaine. So the judge says, how can I believe you? You're telling somebody that you told me that you don't use drugs, and right here in the record, you had a positive drug test. So, that kind of thing can kill your case, so to speak, because the judge says you probably do have pain, but I don't think you got that bad of pain because you weren't honest with me. So, it's always best to tell the truth.